So a urinary tract infection is an infection somewhere in the urinary tract, most commonly in the bladder. It's associated with a number of symptoms, which usually manifest as, I feel like I have to go to the bathroom all the time. We call that frequency, urgency, that constant nagging feeling like I have to go to the bathroom. Sometimes I feel like I'm not emptying my bladder because otherwise, why do I have to go right back in 10 minutes later? Although most of the time the patient is emptying their bladder, they just still have this nagging, uncontrollable feeling, pressure in the suprapubic area. That's that area that's right above the pubic bone, just constant pressure there. Sometimes burning as the urine's coming out the tube, and certainly at the end of the stream, sometimes when it gets cut off, get this really intense, painful feeling. Those are classic lower urinary tract symptoms associated with a urinary tract or bladder infection. The true infection is treated then with antibiotics in order to kill those organisms or those bugs that are in the bladder that are causing those terrible symptoms. That's the appropriate course for a urinary tract infection. But there are oftentimes many times where someone has symptoms that seem like it's a urinary tract infection, and it's really of a different etiology. That's where we need to tease things out to see what really needs antibiotics and what the underlying reason for those symptoms are if it's not an infection, and direct the therapy at those things. When we hear about a tragic story like this, it brings to mind a lot of things like, where do I fit into that type of a scenario if I have urinary tract infections? And I do want to make the point that what Tanya Roberts died of was sepsis. Okay. And sepsis is a very different entity than just a urinary tract infection. Sepsis you get from a systemic infection in the body. And it's the body's response to that systemic infection that you get a cascade of an inflammatory reaction from the immune response, that inflammation goes body-wide and then starts to have its inflammatory sequelae or issues on other organs, such as the kidneys, and the kidneys can shut down the liver. The liver then's not working, shuts down the brain. The other thing I would really want to impress upon is when something like this gets into the media, then so many women think, oh my gosh, I have urinary tract infections. What does this mean for me? And will I get septic and will I die? Again, the vast majority of urinary tract infections do not develop into full-blown sepsis. So I do want to reassure women that what happened here is an outlier. Yes, it's devastating. And as physicians, we watch for any kinds of symptoms that the simple bladder infection is going up to the kidney. And then once gone up to the kidney, are there any other systemic signs that there's some early sepsis that's going on? I mean, that's our job. One of the number one reasons why people get urinary tract infections is that they're just not drinking enough fluids and keeping their urinary tract flushed. So the general recommendation is 2 liters of fluid a day. So that's spread out evenly throughout the day to stay well hydrated and just keep things moving. I usually tell women, use the color of your urine as a guide. If your urine is a light yellow color, perfect. If the urine looks like it's water, you're drinking more than you really need, and you're just running to the bathroom all the time. You have better things to do with your time. But if your urine is that sort of pretty golden yellow color, you're not drinking enough. You need to drink a little bit more. The other thing is there's also some good data to support the use of cranberry juice or cranberry supplements that have enough of the active compound in it. The active compound is called PAC, and they need to have enough of that compound for them to be effective. There are lots that are out there on the market that are not effective, so it gets confusing, but we do some education with the patients about what are good supplements and what are a waste of time. And then the other thing, the last thing would be to make sure the normal flora or your normal bugs, we have bugs everywhere, right? On our body and everywhere, but they're all living in homeostasis. The good bug sort of bad bug balance is in check. It's when one of the bugs overgrows that it causes a problem. And so we need to do what we can to keep that balance in check.